Today we will be talking about palpitation. Now, palpitation is a term for traditional Chinese medicine, internal medicine disease. This is actually from the Chinese character Xin Ji. You know, this one is heart. We have another Chinese character. This is Ji. For this character, you can divide it into two parts. The left side is actually heart, and the right side is the pronunciation. So that is actually the Ji. The pronunciation is actually followed with the right part. Xinji is the term for TCM, internal disease, and we can translate it into English, palpitation. The definition for Xinji: palpitation is an unpleasant, involuntary sensation of rapid, irregular, and or forceful beating of the heart. So this is actually a subjective sensation which is very commonly seen in heart-related conditions. And though the primary symptom is palpitation, but you understand we are talking about a disease. So it is often results from failure of qi and blood to nourish the heart, and also motions, external pathogens affecting the heart, or phlegm stasis obstructing the heart vessels. So the disease, palpitation, Xinji, is associated with those causes, not only malnutrition of heart, but also there will be some other exogenous pathogens, emotional triggers, and phlegm, blood stasis, etc. It is often seen in heart impediment. What is heart impediment? Chest painful obstruction. So that is at Xiong B or chest B. And also you can understand with coronary heart disease or angina pectoris. And also inside heat or some pulmonary disease and emotional disorders, psychological disease like anxiety, depression, etc. And endocrine related disorders like hyperthyroidism or hypothyroidism. Those will be with this palpitation. Palpitations or palpitation that can be classified into two main types. The first one is Xinji. This is pinyin. This is an intermittent palpitation due to panic attack, fright, and or anger. So you understand this one is fright related. So the second type is 正冲, Chinese character here, 正冲. Well, this one is different from 经济. So this is a constant palpitation with restless and rapid heartbeat. The keywords rapid and restless. So for those two main types, there are different. Right? In terms of severity, this Xinji is mild. Pay attention to intermittent. And 正冲 is severe. And in terms of duration, usually this one is short, this one is chronic. Even for this palpitation as a disease name, we can classify it to two types. So try to understand. You don't need to memorize all the terms here, as I said, but you try to understand there are some different types based on traditional Chinese medicine theories. Okay, I will show you the terms in WHO terminology. You will find two items here, 1586 and 1587. Those are actually talking about the two different types of palpitations. So here you will find this 经济病. So this is a name, internal medicine name of traditional Chinese medicine. Okay, so it gives you 病, that is disease name. The other one is 正冲病. So you understand those two different types, and they have different translations. The first one is fright, palpitation disorder or fright palpitations. And the second one, 正冲, is fearful throbbing or fearful throbbing disorder. You can read the definition for those two terms. Fright palpitation or fright palpitation disorder is characterized by fright-induced palpitations, panic, jumpiness or easily startled, insomnia, or dream-disturbed sleep, often result from heart qi deficiency, fright, or phlegm heat disturbing the heart mind. It gives you the causes and commonly accompanied symptoms. And then throbbing, fearful throbbing is characterized by irregular, involuntary palpitations associated with some symptoms like chest tightness, SOB, shortness of breath, visible pulsations on the chest at the apex, umbilical venous pulsations, and irregular, intermittent, or abrupt rapid pulse. Pay attention to the causes. That is mainly due to heart in or blood failing to nourish the heart, or some pathogenic factors like obstructing the heart vessels or water retention due to yang deficiency affecting the heart. So it gives you the explanation rapid. Pay attention to the throbbing, fearful throbbing. The second type, 中冲. Now you understand why there's a restless and rapid here. Restless, compare with intermittent. It gives you the difference on severity. The restless is more severe. And for the first type is more related to qi, so that is more related to qi deficiency, heart qi deficiency. But for the second type, that is more related to heart in blood deficiency. Of course, there will be some other exogenous pathogens and also emotional triggers. So just talking about the heart-related material substances, the first type is more related to heart qi, and the second one is more related to heart in, heart blood deficiency. Let's talk about this palpitation, Xinji, this TCM internal medicine disease mechanism. First of all, let's identify the location of the disease. It is heart. This is a very commonly seen symptom for heart, right? Why is that? Because heart controls vessel and mind. The heartbeat is directly associated with heart function. For heart-related symptoms, we say if there's palpitation, surely we will check heart-related issues. And if there's some insomnia, sleep problem, we will also try to figure out whether there's heart-related problems, because heart controls vessels and mind. This is based on fundamental theory of traditional Chinese medicine. So you know this palpitation is actually this heart. Let's pay attention to the heart. We know TCM has two basic characteristics. The first one is holism. Right? We consider the human body as a whole, and we consider the human body is unity with the universe. So the heart can be affected by other internal organs. We have five Zang organs. We have lung, liver, kidney, spleen. Those four, and together with heart, will be five Zang organs. Then we add another one, gallbladder. Here, one organ, because the gallbladder related disorder will be presenting with palpitation. So that is closely related to this TCM internal medicine disease Xinji. So we add this one, the gallbladder, and then those four actually together with heart, there will be 5 So all of the other internal organ, not only gallbladder, for example, stomach. Stomach dysfunction will also affect heart, but those are more important. So you understand what I mean. All of those can affect heart, can result in dysfunction of heart spirit. Sometimes we use heart mind. It's okay because it comes from Chinese characters. So the original term is 心神, Shen, you can use mind, you can use spirit. So the heart itself or dysfunction of other organs can affect and result in palpitation because they affect heart and this heart shen, xin shen, heart shen. Yes, we also have this heart shen. Heart shen is affected, resulting in palpitation. It could be qi deficiency of heart. It could be blood in deficiency of heart. Surely, heart itself will present with dysfunction of heart, mind, heart, spirit, heart, shen. And this will be manifestations of palpitations. And we know some other internal organs, those internal organs, if they cannot maintain normal functions, there will be pathogenic outcome. Let's say that will be, for example, spleen can transform phlegm and can, that is a, spleen plays a very important role in water metabolism. So that will be some kind of, phlegm generation. And also, it could be related to some liver. Okay, so there will be some emotional triggers, some anger, something. That will be what? Liver can regulate qi. So all the qi movement is in charge of liver. Okay, so the anger or some other depression, overthinking something will affect liver function and result in what? Qi stagnation. Okay, qi stagnation. That will be blocking, right? Qi stagnation will be blocking. So it could be blocking of meridians. It could be blocking of blood circulation and result in blood stasis. And also it could be blocking, let's say, abnormal qi flow, resulting, this phlegm generation. So we can also explain the dysfunction of spleen will result in qi deficiency, blood deficiency, yin deficiency, because spleen and stomach, we consider those two are postnatal origin of qi and blood, right? So all of those can mix. The key points is here. heart spirit or heart shen, heart mind. It doesn't matter. You understand what I mean? Okay, so that is not only heart, but also the heart function. It is also related to some narrow concept like mental, like sleep, something. So it is also related to that. So we use this heart shen, heart spirit, heart mind for this. So there will be palpitation. Palpitation is a clinical manifestation for dysfunction of heart spirit. Okay, so for the meridians, say the meridian is mainly associated with pericardium. The meridians, if we focus on acupuncture, then we have to talk about meridian, right? So the palpitation is, where is the palpitation? Mainly chest, mainly this heart. And sometimes it will be associated to some other parts of the body, like throat, like back, something. But mainly the meridians, pericardium and heart meridians. So you understand? We are talking about the palpitation and we are talking about this traditional Chinese medicine, internal medicine, disease. How to treat palpitation with acupuncture? When we treat palpitation, which is TCM, internal medicine disease, based on mechanism, what kind of therapeutic principle should we set up? Actually, the disease location is heart, and the fundamental mechanism is dysfunction of internal organ, and mainly related to the heart. And we have some other internal organ dysfunctions, and there will be some qi, blood, yin deficiency, and it could be with phlegm, water retention, and also it could be with qi stagnation, blood stasis. So the therapeutic principles should be regulating heart qi, calm the spirit, and calm the palpitations. So pay attention to the previous fundamental mechanism. I highlighted those terms like heart, spirit, heart shen, heart mind. Here you will find heart, spirit, or sometimes we use mind, something. So you understand why we use those terms here. So this is actually therapeutic principles for acupuncture treatment. And then based on those understanding, try to find our main points for palpitation. It's very important when we move on to the main points because for acupuncture prescription, always think about meridians. So before you get to main points, try to understand which meridians we will select. For palpitation, disease location is heart. Okay, so we will have heart meridians, and don't forget pericardium. Pericardium meridians. Based on TCM theory, we will use more frequently with pericardium meridian points compared with this heart. Palpitation disease location is heart, but we will mainly use pericardium. Of course, we have heart meridians, right? So these are the main meridians, and we will try to select backshoe points and front move point of those two meridians. So this is our acupuncture principle for palpitation treatment. So before we get to the main points, try to understand the main meridians. We should select pericardium and heart. And what kind of points? Mainly back shoe points and front move. We will mainly select the points on pericardium and heart meridians, and then we'll find some corresponding back shoe points and front move points. So our main points for acupuncture prescription will be pericardium 6, PC6, PC4. So pericardium 6 is 内关, which is actually the connecting point of pericardium meridian. And then PC4, 细门, this is a C-clapped point of pericardium meridian. Those two combined together can regulate heart qi. Also can soothe the qi and blood of pericardium meridian. Say heart qi and blood can regulate heart qi and can activate heart blood. So this combo is for this palpitation treatment. We will have heart 7, which is one source point. Heart 7 is 神门. This heart 7, this one source point, can pacify heart and calm spirit, and also can treat palpitations. And then we have some corresponding back shoe points and front move points. So we have pericardium meridian back shoe point, which is 厥阴枢. 厥阴枢 is bladder 14. And also we have front move point of pericardium meridian. So 人 17, 膻中. So we will add front move point, 人 17, front move point for PC. And then UB14 back 2 point of okay, those points are main points for palpitation treatment. Back 2 point together with a front move point of pericardium meridians can regulate heart qi and calm spirit and regulate qi. So this is for the main points. And then we have supplement points based on patterns. We have the pattern-based points for heart and gallbladder qi deficiency pattern. For this pattern, we will add back shoe point for heart and back shoe point for gallbladder. We will add bladder 15, 心枢 back shoe point for heart, and bladder 19, back shoe point for gallbladder. And for dual deficiency of heart and spleen, we will add back shoe points for heart and back shoe points for spleen. The back shoe point for heart, bladder 15, and back shoe point for spleen is bladder 10. For kidney insufficiency with deficient fat, we will add backshore point for kidney, bladder 3, and then kidney 3, which is when source point of kidney. Okay, so we have this combo to treat deficient fat due to kidney deficiency. And for blood stasis in heart meridian, we have backshore point, right? Backshore point for heart, bladder 15, and blood stasis. So we have bladder 17. This is actually one of the three main points for blood stasis. We don't have many points for blood stasis. Is one of the 8 differential points of blood. We have another pattern, water retention. That is actually water retention affecting heart pattern. It is characterized by cold intolerance, cold limbs, leg edema, palpitations, and inability to lie flat, and cough with thin white sputum. The tongue is pale and enlarged with a white slippery coating. The pulse is weak. The pattern often occurs when water retention due to yang qi deficiency of the heart and kidney. So this one is actually kind of a heart yang qi deficiency, right? You can find in late stage of heart failure for the water retention affecting heart. We will add 2 points. 三焦疏is to be 22 and 9水分 So we add those two for this pattern. So the acupuncture prescriptions are main points together with pattern-based points. We can consider those as supplement points. And the manipulations for excessive patterns, we use reducing manipulations. For deficient patterns, we apply reinforcing manipulations. This is Chinese character. So what is the fundamental mechanism for Xinji palpitation? I think the key words are heart spirit or heart mind. Of course, we can use heart shen. So palpitation is the clinical manifestation of this TCM internal medicine disorder. The key characteristic, the fundamental mechanism is actually heart spirit disturbance. So we know this disease location is heart, and this is heart spirit dysfunction or disturbance is the fundamental mechanism causes. So there will be some kind of qi, blood, in deficiency. Okay, deficiency will result in heart dysfunction. Then there will be disturbance of spirit or mind. And also, there will be some other internal organs like gallbladder, like liver, kidney, spleen, lung. Okay, so those internal organ dysfunction will affect heart too. It could be related to some other, for example, water metabolism. That will be water retention, phlegm, chi stagnation, blood stasis. Now let's come back to fundamental mechanism. I use different color here. I would like to use blue color here. So the disturbance of heart spirit. When we treat with herbal medicine, we have to pay attention to the root, treat the root causes, but also you have to stick to the fundamental method. So let's say if there's deficiency, we will nourish or tonify, for example, those material substance like qi, blood, yin, for qi deficiency, blood deficiency, yin deficiency. And then we do have some pathogenic outcome like phlegm, water, qi stagnation, blood stasis. Okay, so we need to remove or dispel, transform those things, right? But we have another term here. In terms of therapeutic principle, we have a term like calm spirit. And we have a subtype for herbology, let's say herbal medicine. We have calm spirit herbs. Okay, so I want to emphasize for the treatment of palpitation in this chapter as in TCM internal disease, you can treat the root. It could be water retention. You can remove, transform water. And then don't forget we have another one, calm spirit. And if that is, the root cause is heart qi deficiency, sure, we will treat the root cause, tonify heart qi, and then don't forget calm spirit. So this calm spirit is not for insomnia. Even for palpitation, we use calm spirit herbs. Okay, so this is the key point here. We have 6 patterns for heart and gallbladder qi deficiency pattern. Pay attention to the syndrome here. Palpitations with restlessness and prone to fright and easily terrified. So this is actually related to gallbladder qi deficiency. Unable to sit or lie down comfortably. Insomnia with frequent dreaming and easy awakening. Aversion to loud sounds is also because of this fright. Poor appetite with a sense of fullness. Tongue coating is thin and white. Pulse is thin, slightly rapid or thin and wear. So for this, we will reinforce qi of heart and gallbladder. But don't forget, we have this, calm the spirit. So make the sentence for treatment principle. Calm, bright, and settle the mind, nourish the heart, and calm the spirit. So we use modified 安神定律 You can start with 安神定律 安神定之外, we have those herbs, medicinals here. 龙池, 茯神, 远志, 石菖蒲, calm the spirit here. And then we have 人参, 茯苓, nourish, tonifying qi, the qi deficiency. Next pattern, this is hot blood deficiency. This is a material substance deficiency. So palpitations with blood deficiency syndrome, right? So the palpitations with shortness of breath, dizziness and vertigo, insomnia with forgetfulness, pale complexion, and fatigue and lack of stress, poor appetite with reduced food intake, pale red tongue, thin and weak pulse. So tonify the blood, nourish heart, and boost qi and calm the spirit. Again, we have calm the spirit here. So we have 桂皮汤. We can use modified 桂皮汤. The 桂皮汤, those ingredients, 当归, 龙眼肉, nourish blood and calm the spirit. 人参, 黄芪, 白术, tonifying qi, boost qi, and 木香 regulates qi. 甘草 as an envoy, it can harmonize all ingredients. So we use modified 桂皮汤. Next one is hot yin deficiency, although there will be a group of yin deficiency syndrome. Palpitations with susceptibility to fright, irritability, though it is relative hyperactivity, insomnia, and heat sensation in the palms and toes, dry mouth, nocturnal sweating, and symptoms worsen with overthinking or mental exertion, accompanied by tinnitus, lower back soreness, dizziness, and vertigo, irritability, and quick temper. Tongue is red, scanty coating, thin, okay, red scanty coating, pulse is red and rapid. So it is a typical yin deficiency, and we will nourish yin and clear deficient heat. Don't forget, nourish heart and calm the spirit. We will start with 天王补心丹. So the 天王补心丹 is 生地黄, 玄参, 麦门冬, 天门冬, nourish yin, and then 当归, 丹参 can nourish blood and also clear heat in the blood. And then we have 人参, 茯苓, tonifying qi, 酸枣仁, 白芷仁 nourish heart and calm spirit. 五味子, 远志 also can nourish heart. So this water we can start with 天王补心丹. Of course, you can modify this. We have the formula ingredients here. Next one is hot yang deficiency. So pay attention to yang deficiency here. We must have coldness because this is yang deficiency. So palpitations with restlessness, chest tightness, and shortness of breath, worsen with movement, pale complexion, cold sensation, cold limbs, tongue is pale with a white coating, and pulse is weak or deep. Usually the yang deficiency will be relative excessive yin, so the tongue could be wet coating. Thin, weak pulse. We will warm and tonify hot yang and calm the spirit and settle palpitations. We will start with the 桂枝甘草龙骨牡蛎汤. Actually, this one is from 张仲景金匮要略. So you will have the 桂枝 here, and then 甘草, 龙骨, and the 牡蛎. We have 4 ingredients in this formula. This is actually for hot yang deficiency. We can start with this one. We can add more herbs. Next one is water retention affecting heart. Palpitations with dizziness, chest tightness, and a feeling of fullness, thirst without desire to drink, reduced urination, or edema in the lower extremities, and also coldness with cold limbs and accompanied by nausea, desire to vomit, drooling. Tongue is pale, swollen with a white slippery coating. The pulse is wiry and slippery and deep, thin, slippery pulse. So this is more related water retention and thin mucus. For the therapeutic principle, we will invigorate heart yang, transform qi, and promote water metabolism, and calm the heart and settle the spirit. So we will use this 灵桂猪肝汤. This is also from 伤寒论 and 金匮要略 by 江仲景. 灵 is 茯苓，桂枝，猪 is 白猪，甘 is 甘草. So we have 4 ingredients in this formula. 灵桂猪肝汤. Of course, this is water retention. So we can add some herbs like 人参, tonifying qi, and also we can add 附子, warm the yang. So this is also 参附汤. Next one is blood stasis, obstructing heart channel. This is the 6th pattern, the last pattern. So this one is presenting with palpitations with restlessness, chest tightness, and discomfort, intermittent heart pain that feels like stabbing, cyanosis of the lips and nails. Tongue is purple or dark with possible fatigue here, and pulse is choppy, maybe not intermittent. So this is a typical blood stasis pattern. And we will set up a principle activating blood circulation and remove stasis or eliminate stasis, regulating qi and unblocking the channels. We will use 血府足浴汤, blood mention removing stasis decoction. So this is the ingredients of 血府足浴汤. So we can modify this formula. We can start with 桃红四物汤. We have 桃仁红花, and then we have 桂枝、生地黄、川芎、赤芍. So those 4, actually we can consider 四物汤, 4 substance decoction. With this 桃仁红花, this is actually 桃红四物汤, right? And then we can add regulating qi herb like 柴胡自壳, like the 桔梗, enter the lung and also can uprise the qi. And new qi can guide blood downward and activate blood circulation, remove stasis. So 桔梗 new qi, it gives the dual qi movement regulation. One is for the upper, it enters the lungs. Another one guides blood down. So put together, this is 血府足浴汤. That's all for today. Thank you for your attention.